Well, good morning, everybody. We are going to go ahead and get our webinar started. So welcome again for coming to the Telehealth Education Spotlight, where we're going to specifically talk today about pediatric PT and OT telehealth. During the webinar, we do welcome you to ask questions. We would love to hear a lot of those. Before I get to that though, we are going to be recording this session and I will send an email out to everyone who's registered so that you will have access to that recording. In the meantime, we hope that you really enjoy the question and answer session. When you're asking questions, if you could go ahead and state the practice that you're in, type whether it's private, whether it is orthopedic, whether it's PT, that would be great. And then also, if you could let us know what state you're in, that will definitely help us be able to answer your questions as good as possible. And then also, to ensure that we get as many questions answered as possible, we're going to be taking questions electronically this morning. And if time permits, we're going to go ahead and open the end of the session up for verbal questions as well. So to do your questions today, at the bottom of your screen, there should be a Q&A section. Please feel free to go ahead and start putting questions in as soon as you think of them. You can also raise your hand. That's another option you'll see at the bottom of the screen. And then lastly, go ahead and send a question via chat. Just in case you guys haven't had a chance to review these, this session actually is designed to answer questions from both the webinar for telehealth in an outpatient pediatric setting clinic, which you'll see here at the bottom there. I'm going to go ahead and post this link as well as the link above to the PT Telehealth Educational Series in the chat window here in just a couple minutes, so you'll be able to copy and paste those. I would highly recommend, if you hadn't had a chance to watch both of these resources, that you do. It will often answer a lot of questions you have. It's also just great to go back to as well. And then also, there was an update that came out yesterday in relation to the new CMS guidance. We're going to reserve 5 minutes of the session today at the end of the session so that we can discuss that and ask questions specific to that. So please make sure you stay tuned to the end so that you can get some information there as well. So now I'm going to introduce our presenters. First, we have Joan Mountain Eliot. She is our resident PT. Joan, if you want to go ahead and introduce yourself, that would be great.
Hello, everyone. It's great to be here. I just wanted to welcome you all and hope that this is an informative session on telehealth and how we can go about doing it in our professions. I currently work for Premier Pediatric Therapy Source. I also in the clinic, and I'm also teaching for Rehab Essentials and Marymount University. I've had a variety of clinical practice experience, but the past 20 years, it has primarily been in pediatrics. I look forward to hopefully answering some questions on telehealth today.
Thank you, Joan. And Debbie is our resident OT expert. Debbie, please introduce yourself.
Hello, everyone. Welcome. I am Debbie Allen. I'm the owner and executive director of Premier Pediatric Therapy Source, where we provide OT, PT, speech therapy, and nutrition services for children birth to 18 years of age. And I've been a pediatric occupational therapist for the past 14 years and have had the opportunity to provide services in outpatient clinics, school-based practice, as well as early intervention. And I've worked with a wide range of populations ranging from mild to complex conditions with a specialty in working with children who have sensory processing challenges. Prior to becoming an OT, I worked in the social services industry with children and families from high-risk populations where I was able to support the needs of families as a family unit and connect them to resources in the community, as well as provide parents with education on child development. So my experiences both before and after becoming an OT have really shaped how I think about families, the families that we serve, as well as helped us to come up with our practice philosophy in providing comprehensive care. So that's a little bit about me, and looking forward to answering your questions.
Wonderful, thank you. And then Robbie, if you wouldn't mind introducing yourself and let us know a little bit about yourself. Oh, Robbie, you're on mute. Sorry.
Thank you. Welcome, everyone. Glad you're here. My name is Robbie Leonard. I am a physical therapist, and I don't treat pediatric patients. I'm here as a person to answer your questions about payment and policy and documentation and billing and coding as it relates to telehealth. So welcome.
Thank you, everyone. Okay. And so we're going to go ahead and get started with our questions. We do have a couple that are coming in here. The very first one that I'm going to go ahead and ask, though, is following the coronavirus pandemic and moving forward to the clinic, how do you see telehealth services best utilized in the clinic? Joan, did you want to take this one?
Sure. And I think that's actually a fabulous question. I think that us as clinicians is vital to our practice, and I think we can't take that away. But what I've learned through the telehealth sessions that we've been doing is that it would be really nice to have telehealth as an part of a practice, so that we would do evaluations possibly with patients in the clinic, and then follow that up with possible telehealth visits. You know, telehealth, I think Robbie can speak to this best, has been around for a long time in a lot of rural settings. But what we're finding where we live in Northern Virginia, where, you know, traffic can be a problem, that, and both parents are working, that there are challenges to get out to the clinic. I think the strategy that we have to perform now is to figure out how we can best provide some research to insurance companies to make them understand how vital we have been during this pandemic in helping children and in helping parents with their children.
Wonderful, thank you. The next question is coming from Vanessa. Private outpatient pediatric clinic in rural Georgia. And she has a two-part question. The first part is, what outcome measures do you recommend for the client with intellectual impairments with moderate to severe behavioral issues via telehealth sessions? The assumption that follow-up assessments will be in the clinic. And secondly, can you give suggestions of goal setting that can be assessed in the clinic during the 3 to 6 month plan of care updates? Joan, Debbie, would either of you like to take?
One more time, because I want to make sure I have all.
Yeah, I'm kind of writing it down as well.
I'll do part 1 and part 2. How about we do that?
Okay,
So the first is, what outcome measures do you recommend for the client with intellectual impairments with moderate to severe behavioral issues via telehealth sessions? The assumption that follow-up assessments will be in the clinic. So that's the first part. So I'll let you guys go ahead and answer that, and I'll get to the second.
So I think I can take a shot at that one. An example I can give you is actually a child who I evaluated who had just been diagnosed. He's 4.5 years old with autism with the behavioral component. And so outcome measures, so no, we're not doing a standardized test, as you know, with kids with autism. That's really challenging to do. But we're trying to figure out how to help these parents while they're in the home with the child and have not been with that child for a long period of time, kind of understand those behaviors of how we can guide that child to be able to perform functionally better. So the goals, I looked at the outcome measures in thinking forward, and when he goes back to school, thinking, you know, ball skills are really important for kids with autism because it's a social thing to get them to be able to participate. And then, other activities are to get him, seeing that he had poor core strength and by the activities that he was doing in his home, seeing that he had poor motor coordination, I was then able to help the parents with what they had in the home, put together, we're starting off as a long-term goal, a 3-part obstacle course. Can this child perform a 3-part obstacle course that works on all those components that he needs help with in terms of gross motor control, functional activities, and see how he then can perform those activities. So the outcome measure is, can he perform a 3-part obstacle course after 3 sessions in working with the parents? Ideally, he'll be seen in the clinic and we'll take that up in the clinic. But all these activities are things, I talk to the parents about getting them to understand what you're teaching him is to go from one activity to another as well. And all those things require listening skills, many skills, gross motor skills. These parents set up with solo cups and put the letters of the alphabet on the cups and set up a pyramid and had him kick the ball, in a space. And I was able to coach those parents that, well, maybe, do you have a bigger ball? Yeah, so let's use a bigger ball. So really the outcome measures are, we're looking at functional things that child's going to be able to do back in the classroom setting as well, and out in the community with his parents.
And I'd just like to add to that, just to piggyback off of what Joan is saying, is that, finding out from the parent, just in the beginning, the baseline functional skills of the child, what is the child currently able to do, and what does the parent really want the child to be able to do, and then being able to observe that child actually performing those particular activities and figuring out where the child needs the most support, and how can you help guide that parent in providing that support. So, I think the most important thing when it comes to providing services or an evaluation via telehealth is really keying in on what is the parent's primary concern for that child, and what is that functional impairment within the everyday activities that the child is doing, and being able to develop outcomes off of that.
And I think you guys have kind of answered part 2 of the question, but I'm gonna go ahead and just clarify just to make sure. But the second part of the question was, can you give suggestions of goal setting that can be assessed in the clinic during the 3 to 6 months plan of care updates?
Yeah, so I think Joan touched a little bit on this, but the goal setting, really it's, in general, what we're trying to do when we're evaluating a child and getting those outcomes is figuring out, what is it that the family wants the child to do, and what is it that the child needs to be able to do to be able to function in everyday life, whether that's at school, in the community, at home, wherever that child is going to be. And so when you're developing those goals via telehealth, those goals are based on those functional concerns. And so being able to carry that over into the clinic is very similar. You're still addressing those functional concerns and those functional goals. And I think in a lot of ways, telehealth really helps with this because we're able to actually see what's going on in the home. So when we're back in the clinic, we're able to really overlap the different strategies and activities and exercises that we were working on with the family at home, and being able to provide, I think, a more richer experience in the clinic, because now we have something, we're able to see more of what was happening in the home. Whereas before, when we were in the clinic, we didn't really know what was going on in the home, and we didn't know the setup of the home and what the child was, how the child was actually functioning in the home. So I think that they both complement each other very, very well in being able to approach those outcomes very similarly.
And I would agree with Debbie in the sense that on top of the goals, we're also, I really am seeing that we're helping empower these parents, and they're seeing the goals, I think, in a different perspective than they do in the clinic. I think they all understand, what our goals are because we talk about them with the parent, but I think they're understanding it much better now by actually being a part of the action.
Sorry, I was stuck on mute myself here. Thank you both very much for answering that. I think that helped that question. Going to move on to the next question. So we have a question from Tina in rural MS school system. She's a PT there. She said they have offered but not gotten approval for telehealth appointments. Are there school systems that you know of that are using this currently? And the parents are interested, but they need the approval from the school system, and how can we help them do that?
So I will say that yes. So the answer is yes, but let me expound on that a little bit. In South Carolina, as just an example, our school is really critical in getting our Medicaid covering telehealth, because the school systems themselves went to the state and asked for coverage so that the children could continue to be seen by both their school therapist and their private practice therapist. So I would say that's very state specific, but if your systems are not allowing that or offering that, then I think I would be getting an advocacy effort and getting my school administrators involved in providing those services for children that need it, since you can't provide it in the school system currently, in person. Debbie and Joan may have others info to offer.
I'm not sure about in our area what the schools are covering. Our practice in particular doesn't contract with schools, and so I wouldn't be able to speak to that. Sorry.
And I can speak to it just knowing occupational therapists and physical therapists working in the school system now, that they're actually doing more of a coaching model where they're, it's not called telehealth, where they're calling parents, checking in, making sure, if there's anything they can do to help guide the parents. And that's kind of the model they're using.
Perfect. Thank you all. The next question actually I think applies just generally as well, but what are the frequency and duration of visits that you've been recommending? Are those the same as you would see in personal visits?
I can answer that question. So it really is individualized, because not every child can handle, like, for example, typically in the clinic, our sessions are 45 minutes for speech and then an hour for OT and PT. And via telehealth, we are finding that some children and families can do that. They can do 45 minutes and they can do 60 minutes. But then there's some children and families where that's just too long. And the kids can't, if there's something that the therapist is working on at the computer screen, the children aren't able to stay and focus on the screen for that amount of time. Or if they're not necessarily focused on the screen, but they're doing something more movement related, you know, after a while, the kids just start to fizzle out and they just can't, you know, tolerate the length and the duration of the session. So what we've been doing is really, you know, each time we meet with the family, we're really assessing that child's behavior and their ability to tolerate. And if we need to shorten the session for that visit, then we do. If we're starting to see a pattern with a particular family where, you know, it's obvious that, you know, an hour is just too long every week, then we pose different options for them. So for example, if we know that the child really does need an hour a week, then we pose to them, how about doing twice a week for 30 minutes, just to be able to break it up a little bit. So in a nutshell, you know, it's very individualized. It's not a cookie cutter type of duration or frequency.
And I would agree with that. I think it really depends on the child. You know, there's a child that I'm seeing who had a stroke, who's 7 years old, who I see twice a week, and she can tolerate that. There's another child who I evaluated with developmental coordination disorder. I probably would have seen him once a week in the clinic, but because he's not getting a lot of the interaction that would be helpful for him, I'm actually seeing him twice a week. So it really just depends on the child and the environment that he's in at the time, to really determine the dosage.
And I think one thing to keep in mind is that, you know, everybody is really on a different schedule right now with COVID-19 and are, you know, just trying to adapt to just a new normal. And so the kids aren't, their behaviors are different, you know, the parents' behaviors are different. So I think just having that flexibility and allowing families to know that it's okay if we need to shorten the session for that day, because something that I know personally I have found with at least one of my families is that the parent feels really guilty if her child's acting up a little bit, and feels guilty because you know, we're scheduled for an hour session, but the child that day can only tolerate, you know, a half hour. And I think sometimes it's important to give parents that permission that it's okay if today, you know, we only work for 30 minutes.
I think another thing to point out with the dosage is to think about the clinician as well. What we're doing now is we do an hour session, so it's a 50-minute session for therapy, typically for physical therapy. And then we have our same notes and everything we write within our EMR system. But then we take 15 minutes before we see the next child, because we're not used to being in front of a computer screen. And so I think it's also important to look at it from the clinician's point of view as well, and what works there as well, and what makes us more productive.
Thank you very much. The next one's actually just a statement, and I think a lot of people probably are in the same situation. And Robbie, it might actually be something that's different as of yesterday, not sure. But it says, I work in a hospital outpatient department in Indiana, and they're currently unavailable to do telehealth. So thank you for sharing that. Robbie, is there anything that you know that might be changing that in the near future with the new guidelines? Robbie, you're on. There we go.
Yeah, there we go. So a couple of things, and we'll talk about this at the end, but Medicare has made some changes as of yesterday. Unfortunately, currently, we don't know if those changes will apply to hospital outpatient departments. So the APTA is trying to get clarification on whether Medicare is going to cover telehealth for traditional hospital settings, outpatient hospital settings. So we're still waiting on that answer. However, most of your private insurances have said that they will cover telehealth for all outpatient settings. So if your hospital would like to do telehealth, there are some payers that are currently covering telehealth for that setting. So it's not that that it's not covered by anyone. There is some limitations to that coverage. What I find with most hospitals that I work with is that a lot of hospitals are struggling to get their platforms up and running, and they certainly have a lot more corporate compliance challenges sometimes than some of the private practices that can move a little faster. So I'm finding that hospitals are working towards that, but it's just a slower process.
Thank you, Robbie. The next question is, what guidelines do you give parents prior to an initial session to make the session successful? Are there any items that they may need, etc.?
Yes. So before we start to see a family, we will send them a handout of what to expect during a telehealth session. And in that document, we have what the device that's compatible with the platform that we use. We use Zoom's healthcare platform. And so we give them, the compatibility requirements to be able to get onto that platform. And then we basically spell out for them, this is what the initial session will look like. This is the type of information that we would like to gather during that session. And then we also include in that, how a session is typically going to look like, so that they have a general idea of what to expect. In part of that document, we make it very clear that the parent is going to be an active participant in the telehealth session, so that there's no surprises there when the therapist is asking the parent to maybe move a child to a particular place in the house or to place them in a particular position. And also so that the family's aware that we don't want them to be kind of using that time as a respite, to go and do other things and to sit the child in front of the computer screen with the therapist to talk to them for an hour. It really is to have parent participation for a variety of reasons. One, we're not physically there to be able to engage the child physically to do those activities, but more importantly, the carryover happens when the parent understands what their role is in helping to carry over the different activities and exercises that will help that child to make progress between sessions. So we really, I think it really lends for the parent to really get that education and that participation piece, so that they feel confident in being able to carry over what they're learning.
Perfect. Thank you, Debbie. So the next question, I think, is going to be for Robbie, but can or should we record the telehealth session with the child with the parent's approval? Is this allowed or not allowed?
So there are, I think there is one state that I'm aware of, and I think maybe only one, that actually requires you to record telehealth sessions in order to perform telehealth legally in that state. However, most of the recommendation is that you do not record telehealth sessions, because that requires a lot more hoops to jump in. And how do you store that? How do you store it securely? Do you have the space to store that? What are you doing with that? What are you doing with those images? So unless your state specifically requires that, my recommendation would be that you would not record the telehealth session just like you would not record a typical in-person session unless you're trying to do something specific with that recording. And that, you treat the patient through telehealth just like you would an in-person session, and document that session just like you would had you had the child in your clinic. So, you document that you performed the visit via telehealth, what platform you used, that the parent was present, and then just your regular documentation, just like you would normally. And that should be sufficient record for the telehealth session. No need to record the session itself.
And Robbie, you basically answered this, but slightly different. So I'm just going to go ahead and ask the question. But do you foresee insurance companies making a request to see recorded telehealth sessions?
I do not. They're going to look at the claims. They're going to look at the codes that you build on those claims. They understand if you're billing. Every payer is doing this a little different in that they're asking us either to file a place of service code, O2, which means telehealth, or they're asking us to use modifiers on the claim like a 95 or a GT modifier that indicates to the payer that you're performing that session via telehealth. So they'll have that information. They'll know that the service was provided via telehealth. They're providing that as a benefit during the pandemic. I do not anticipate anyone requesting recording. They may request your documentation just like any other visit that you do, but I do not anticipate anyone requesting a recording.
Thank you, Robbie. Okay, the next question is with regards to a PT in the New Jersey school system. And the question is, if you are currently working with a child and the platform changed to teletherapy, do we need to get an informed consent?
So I'll answer this from a compliance perspective, and then you guys can share with what you're doing. But from a compliance perspective, yes, you're changing the platform, so you need to get specific telehealth consent. Now, some states, like I believe it's Georgia Medicaid, has a specific telehealth consent form that they want you to use. So you again need to be aware of your payer requirements if they have a specific form they want you to use, or if you just have your own general telehealth consent form. But your telehealth consent form should outline risks that are specific to telehealth, risk of transmission of images and that sort of thing, even if you're using a HIPAA compliant platform. So the risks are a little different than, that you can't always see everything, that there may be a disconnection that happens, that you can't put your hands on the patient and feel them. So you want to outline those risks and have the parents accept that and sign that telehealth specific consent form.
Debbie, Joan, do you have anything you want to add to that in terms of how you are doing it?
It's basically the same. Yeah, we have all of our families sign a telehealth consent form that outlines the benefits and then also, as well as the risks.
Perfect, thank you. The next question is, does the child you are having the session with have to be in the state in which you are licensed to practice?
Yes, so the licensure requirements, and there's been some misunderstanding about this. Some of the licensure requirements were waived for treatment specifically of COVID-19. So some therapists read that and thought that they could practice across state lines, but that is not the case. So every state practice act that I have read has said that the therapist needs to be licensed in the state where the patient is located. So if your patient is located in whatever state they're located in, you need to have a license in that state. We do have compact licensure in some states. If you wanted to cross state lines, you would need to look into that or get a license in the state. But as it stands, you would need to be licensed in the state where the child is located.
Thank you, Robbie. The next question is about patients selection. So how do you go about choosing which pediatric patients are best for telehealth? What's the criteria for looking at that? Obviously, it's hard to see all patients due to based upon the severity of the condition and the complexity of their condition.
So I can answer some of that, and I think Debbie can as well. One of the things for criteria, because the parent is involved with this, we have to make sure that the parent is, somewhat tech savvy, but we can kind of guide them, because that is a factor. If they have a difficult time, then it may be challenging. And again, I think it's, again, an individual, on an individual basis as a child, as we see the child. I have 6-month-olds that I'm working with where I can work with the parent. I use a lot of like doll models to be able to show the parents. But so a lot of it depends on that. There could be a language barrier. We have a language line, and we have had some therapists working with parents via a language line doing telehealth. So it can happen. It really is just going to be individualized by the child's needs, and then what the parents can help with as well.
Mm-hmm. Yeah, I would agree with what Joan is saying. The only thing that I would also add to that is also the parents' cognitive abilities and understanding as well, because you really do have to recruit the parent to participate and to be able to be a part of that. So if they don't understand what's being asked, and if it's a child that's younger or also has a cognitive disability, then it really makes it hard to be able to, even with the easiest child, to be able to conduct an evaluation or an ongoing session. But, for us, we haven't found, outside of one family, we haven't found a child that we couldn't evaluate at this point. It doesn't mean that it won't come up. It's just so individualized to, I think those are probably the top 3 factors is, does the parent or does the family have a device that can connect to the platform? Language, or, do they have somebody within the home who can provide interpretation if the therapist doesn't speak that language, or do they have access to a language line or something like that? And then just, the child and the parent's cognitive abilities to be able to understand instructions and follow instructions.
Yeah, and I would say in this time of everybody staying at home, I would ask questions about who else is in the home, right? So, when you are normally working with mom, maybe dad's available, or maybe there's a teenager in the home that is very tech savvy. So I think creatively, because we are in strange and unusual times, and you may have more support in the home than you would typically have in a normal, given day.
Thank all 3 of you for that one. There's another question that kind of comes out of that. So we just talked about how to evaluate, is your patient someone you can do telehealth with? So coming out of that, another question we have is, what are the most important aspects of telehealth PT evaluation with children? And I'm assuming that's during the evaluation session. Joan, you're on mute. Sorry about that.
That's a great question. And I would say that the number one, there's 2 things. One is we do a pre-assessment. So we have the parent fill out a pre-assessment form, and taking the time to do a really thorough history is critical. And then I think the second piece is building the rapport, and that can take some time, but it's so important. Not only learning about how the child's doing, but how is that parent doing? How's the family doing? those I think are the two really, really, really important pieces. And then all the other parts are important, but I think those are the two factors I would say, because you know, we need some degree of buy-in from these parents to get them to understand that they really, you know, we're coaching them right now and we're guiding them, but they're a really important piece. And I think it's actually been wonderful to see, because we're seeing the empowerment that parents are now feeling like, I can do this. Oh yes. Now it's more challenging for many cases, like cases with neurological issues, where you can see by watching that child is not putting the same amount of weight on their one side as they are the other. But it's how do we then, okay, so let's take it back a step and have this parent, you know, put the child up on blocks and have them do some weight shifting, but building that rapport with that parent to get them to go, oh yeah, now I understand why I'm doing this, is really, really critical. And the history is very, very important.
And we kind of answered this a little bit, but it's a similar question, a little bit different. But with a PDMS-2 test, how do you document that with pediatric patients? Is a PDMS-2? Sorry, I'm not a technical person. Obviously I run webinars really well, but hopefully I stated that correctly.
So I think there's a time and a place for the PDMS-2 test. And so I would not be one to be utilizing that test, most likely, during a telehealth session. I'm more looking at outcome measures that I can use that look at function and look at the child's deficits, so that I can say, in 3 weeks from now, I can do an objective test. Balance on one leg for a 7-year-old for 10 seconds. Can he do it on the right and left? You know, and then I can say, okay, he's now doing this, doing it with better form. And he can go up and down the stairs using a step over step gait pattern that he couldn't do 2 weeks ago. So there is a time and a place for those tests, but I wouldn't be using it most likely in a telehealth session.
Perfect, thank you. And then this one, Robbie, this is for you. They'd watched the session on e-visits. And they are, by the way, it's from a rural setting for a pediatric outpatient, but they are still using audio visual. Is that the difference between telehealth and an e-visit?
Yeah, so an e-visit is confusing for everybody. An e-visit is when a patient or a patient's family in this situation ask you a question via a secure patient portal. So for those of you who are familiar with hospital systems like Epic, you know, I'm a patient in a hospital system that has Epic. I can go ask my provider a question via my chart and they can answer me. And that is a patient-initiated question answer that would be billed as an e-visit. When you are doing real-time audio-visual interaction, performing treatment, then that's telehealth, and telehealth would be billed using regular CPT codes. So if your payer is only covering e-visits or phone visits, those are not the same as telehealth.
Thank you, Robbie. And we have approximately 12 minutes left in the session. So I'm going to go ahead and switch gears really quickly so we can talk a little bit about the CMS guideline update. And then we can come back to any questions anyone has. So please continue to send in your questions. So perfect. You should be able to see on your screen now, or within a couple seconds, of course, the link that specifically talks about the guidelines. Robbie, I'm going to turn this over to you, but I am going to put that link inside the chat menu so that you guys have the ability to copy and paste that as well and take a look at that article individually. But Robbie, I'll let you go ahead and talk a little bit about this.
Yeah, so some of you may or may not be familiar. So this is a Medicare specific guideline. So if you treat pediatrics, maybe you're not doing a lot of Medicare, but the good news is if you do treat pediatrics, a lot of our Medicaid programs and private insurance programs follow along with what Medicare does. So usually when Medicare opens the door, others open the door as well. So Medicare, as of yesterday, came out with an additional waiver that includes PT/OT and speech language pathologist under the list of approved providers who can provide telehealth services to Medicare beneficiaries. So what that means is that you now, and it was retroactive back to March 1st, so if you work in a setting where you see a multitude of different ages, you will now be able to see your Medicare patients via telehealth, bill regular CPT codes. There's a list of CPT codes at the link, and you will be able to treat those patients via telehealth. Those are our highest risk patients, typically speaking, and you'll be able to provide this type of service to your Medicare patients and get paid for it at the regular Medicare rate. Like I said, from the pediatric perspective, many times our Medicaid programs will follow our Medicare guidance. So if your Medicaid program in your state has not opened the door to telehealth, this may prompt them to, and I would also be bringing that to their attention if they have not done so from an advocacy perspective. Most of our private payers have already opened the door to telehealth for therapy, except there's a few holdouts like Humana, and I'm hopeful that Humana will also, they typically follow Medicare guidelines. So since Medicare has made this change, I'm hopeful that any holdouts that we have in the private insurance world will open the door to this benefit. If you are bent to do advocacy, which I think we all should be doing for our profession, obviously most of these telehealth benefits are for this emergency declaration timeframe. And so when we get out of this emergency declaration timeframe, then our benefit for telehealth will go away unless we are doing good advocacy efforts and showing the effectiveness of using this technology to treat our patients. So I'm very, I would encourage you to, think about your need for advocacy efforts for ongoing, and, what tools are you using to evaluate the effectiveness of treating in this way patient satisfaction, family satisfaction, the outcome measures that you can do, like Joan had spoken about. So those are all still work for us to do as a profession if we want to keep this particular way to treat our patients intact and have it paid for by our insurances.
Perfect. Thank you, Robbie. And then just in case any of you do have additional questions you think of following the webinar, please feel free to email us at social@rehabessentials.com, and we can get with any of the 3 experts that you've been talking with today, and we can get you a response fairly quickly. I will go ahead and also add that into the chat menu. I think that we kind of have time to just wrap up really quickly, and then I'll open up for some verbal questions if anyone has any. But when you, Joan and Debbie, this one's more for you. When you guys started with the PT telehealth for pediatrics, what were some of the key things that you learned that can help everyone who's on the call?
Joan, do you want to go first?
Sure, great question. I think do your research is a really important piece, because before we got started, I spent probably a day going to the APTA, going to HPSO, going to all the different places to see, well, what do we have to do to get this started? I would say the other piece is to make it seamless as you can, in the sense that we use the EMR system that we're using now. We have the same evaluation forms. We do the same progress notes to our doctors after every 4th visit, our same progress notes on the EMR. And I agree with Robbie. I think document as much as we can, because I do see this as a benefit for the kids, and going forward for families, for us to be able, not taking away from what we do in the clinic, but to really almost enhance our practice as therapists.
And I'm going to respond on 2 fronts, as a business owner and then also as a therapist providing telehealth. Is that on the business side, I think the thing that I've learned personally is how helpful having a documented plan is. Being able to piggyback off of Joan, do your research, but do your research in a way of, what have other people done to get telehealth started at their facilities, and then individualizing and personalizing it to, our own practice and what we do, internally. And so that was something that was really helpful on the business side of things, is just plotting out the different phases of rolling out a telehealth program, and then, implementing it. But then on a provider side, I think what I've really learned and what's been really eye-opening for me has been how much telehealth, I think, has really helped me to see another side to the families I serve, meaning, what's going on inside the home that I didn't know about before, what they have as resources. I mean, certainly in the clinic, I'm asking questions from families like, what do you have at home to work with? But sometimes it's hard to really get a good picture of what are they really working with, because the parents will kind of pick and choose things that they think directly relates to what you're working on. But then during the telehealth visit, you're seeing so much more. And I think, like, once we get back into the clinic, I know for me, it's really going to help enhance how I work with the families that I'm working with, because now I know what's in their home, I know what they're working with, and I can provide better information and better support.
Thank you both. And we've had a couple last minute questions come in. I'm going to go ahead and ask those really quickly. The first, Robbie, definitely this one's for you. Do the Medicare Advantage program follow the general Medicare guidelines?
Yes, every Medicare Advantage contract I've ever read, and I've read thousands of them, unfortunately, say that they follow CMS guidelines. So typically, if Medicare is covering it, then Medicare Advantage plans need to cover it or have to cover it. Medicare Advantage, actually, many of our Medicare Advantage plans started covering telehealth before Medicare did themselves, because Medicare can offer more of a benefit than regular Medicare. But yes, that definitely, now that Medicare has, traditional Medicare has opened the door, the Medicare Advantage plans should be following suit.
Thank you, Robbie. And then the last question actually talks more about marketing and working with parents to try to get them to try telehealth. So this is from a PT who's in private practice in Indiana, and she is asking, how will we market or get our parents to try telehealth? Joan and Debbie, can you tell us a little bit about what you've done?
Sure, and that's actually a really great question. I think that's kind of the $1 million question, coming from a business side of things. So, for us, we did ours in phases. So we started off finding out what families were interested in telehealth out the gate. And, we found that there was about 60–70% of our families that were interested, but we still had 30% that were not. And so some things that we did was coming up with the what to expect during your telehealth visit handout. Because I think that for some of our families, they couldn't see how telehealth was going to work because it wasn't in the clinic and we didn't have the swings and the equipment and all of that in their home. So they couldn't really envision how telehealth would work. So putting together that handout and disseminating it to our families actually really helped some families to actually call. We also had our therapists, after a couple of weeks, get back in touch with the families that weren't interested and just to check in to see how they were doing, to see how the child was doing, and to talk about how telehealth has really been benefiting some of the other families that they're working with, and that really helped in getting some families on board. And then some other things we did is we put on our website that we're offering telehealth. And again, we outlined kind of what to expect. You guys can go to our website and see kind of how we laid it out just as a reference, but and our URL is premierpedstherapy.com. But I think that really helped for new families who were kind of interested in telehealth but didn't know what to expect, to kind of have a general idea of, oh, okay, I could see how this could work. And I think that this could work for our family. And then our other families that we were currently seeing but that opted to put telehealth on hold, we also directed them to the website to be able to look at that information as well. So those were some of the kind of initial things that we did to market it. And then our Facebook page.
And I would just add to that, the only thing is having your therapist be your marketing tool. I have been in communication with many physicians. And if you think about it, it's because we're the ones that are seeing these children now more often than the physicians. And they're valuing what we're doing. And I think that's a really important piece in marketing, is if the physicians are seeing and then the families are relating to the physicians how this is helping, then that's going to be a great marketing tool.
And I would add one last thing to that. Instead of having your front desk, when they answer the phone, the patient's going to cancel because they're worried about coming to clinic, instead of asking the question, would you like to do telehealth? Then I would say, oh, well, Ms. Smith, we have a 10 o'clock appointment for our telehealth on Friday, and we can accommodate you that way. Let me tell you about that. Instead of, and if they're concerned but they have the capability, well, let's try a session and see how you feel about it. There, no harm, no foul. So I think, a lot of times it's, instead of just like, you're with your children, instead of asking permission, you're giving them options. And instead of, just assuming they might not want to do it, assume that they will want to do it.
Thank you all very much. I know we're running a little over. I'm going to take one last question really quickly. And then if you have any questions, again, just email us at social@rehabessentials.com. And we'll make sure one of these experts that has been presenting today will get back to you. So the question is, let's say we started with telehealth therapy with one of our clients. Does it have to be telehealth all the way through the treatment session until the day of discharge? Or can they transition back to the clinic after the pandemic without being discharged?
Yeah, there is no requirement that you keep a patient telehealth if you start them that way. And in fact, I think many clinics will find that they like interspersing the telehealth session here and there, like just like Debbie said, to see the home environment, to see the resources, to get that kind of information. So there is no reason that you can't transition a patient back to the clinic, or even alternate, or intersperse telehealth where it's appropriate. So there's no reason, especially at this point in time when it's being covered, that you can't do both.
Perfect. Thank you, Robbie. I do want to thank Debbie, Robbie, and Joan for joining us today to be able to talk a little bit more specifically about pediatric PT and OT telehealth. We are going to be ending the webinar here in just a moment. Again, please feel free to check out any of the links that we've included in the chat, both from the telehealth series. It's very informative, just generally how to implement telehealth, as well as a webinar that Debbie and Joan had done recently. Please check that out as well, and then the link to the new CMS guidance. With that, we thank you very much, and we hope that you stay healthy and well. Thank you.
Thank you.
Thank you.
Goodbye. Y'all have a great day.
Bye, you too.